Hello everyone, welcome back to GrowMed. So in this video we will be discussing 10 most important topics from the dermatology, and these topics are mainly the previous year questions and previous year topics, and these are the repeat topics which are frequently asked in the exam. Okay, so this PDF is a list of the important topics, and along with that images and previous year questions all I will be discussing in this video. Okay, so if you do these things from the dermatology, and also I have uploaded two videos on the dermatology. First one, the image based questions. Okay, so the images you need to look at that video for the images which are important from the dermatology, and one liners video. Okay, so do watch these two videos, and along with that another video of the important topics which you must cover. Okay, so if you do these two three things from the dermatology, you there's no need for you to go to some other source. Okay, so all the things will be covered here and you will be easily able to solve the questions. See, as the dermatology is a very short subject and doesn't compromise much huge marks. Okay, like only 4 to 5 minimum, sometimes 7 to 8 questions can come from the dermat, and these also can come in the integration with the micro. Okay, so these are the important things which you must keep in the mind, and instead of giving a lot of time in this dermat, it's better that you just look at the high yield topics. Okay, so this video will also help you in the last minute revisions, and also you will be watching the videos, right? So while watching the video, keep the PDF in front of you and go through the points, so it will help you in your revision also. So let's discuss the most important topic which you cannot miss from the dermatology. So the first important topic is the pemphigus, and make a note that in this dermatology exam, either there will be question on the pemphigus or the pemphigoid. Okay, bullous pemphigoid or pemphigus, one question will be coming, and every year it has been coming. So the things which you must remember from this is that pemphigus, it is an autoimmune disease, and in this the IgG, immunoglobulin G, acts against the desmoglein. This is a type of the protein, and this whenever this desmoglein is involved, it will be causing the pemphigus bulla. Sorry, bulla like appearance can be seen, and these bulla which are seen in the pemphigus, these are the intra epithelial bullae, and the two types which you must remember is the vulgaris and the foliaceous. So vulgaris, wherever you see the vulgaris in the dermat, it is the most common variety, and in the vulgaris desmoglein 3 is involved, whereas in foliaceous it is the desmoglein 1 which is involved. Okay, then the important things which you must remember from this is two important sign which we can see in this disease: Nikolsky sign positivity and the bulla spread sign. Bulla spread sign means whenever you put a pressure on the bulla, it will spread to the surrounding area. Okay, so that one is called as the bulla spread sign, and whenever you see these things in the question, then think in terms of the pemphigus. Okay, so if in the option pemphigus is given, then that will be the answer. Then on histopathological examination, you can see acanthocytes. Acanthocyte means separation of the cells. Okay, so you can see this one, and also a classical appearance seen is the row of tombstone appearance, and this is also very important finding seen in the pemphigus. So these all are the important hint which can be given in the question, or you can say that the buzzwords which you must recognize and mark the answer. Then on the DIF, that is the immunofluorescence, you can see a fish net like pattern. See this image based question has been asked, and you can see here that this appearance look like the fish net. Okay, so whenever this thing you find in the exam, then think in terms of the pemphigus. Okay, so this appearance is due to the intracellular anti-desmoglein antibody, deposition of the anti-desmoglein antibody. Okay, so these are the things from the pemphigus. Then moving on to the bullous pemphigoid. So this is also an autoimmune disease, and what happens in this is the IgG attacks the BP antigen 2 or the BP antigen 1 cells, and clinical feature is the formation of the bulla. On the histological examination, you can see subepidermal split with eosinophilic collection in the layers of the skin, and on the direct immunofluorescence, you can see linear deposit at the basement membrane. See, as you can see here, that the bodies, these are deposited in a linear fashion, मतलब they are deposited only in one way, unlike this one. यहाँ पर सब जगह में these are deposited giving a fishnet, but in this it is situated only along a single plane, you can say, and this appearance is called as a linear deposition at the basement membrane zone. And the deposition is mainly made up of the immunoglobulin G and the complement proteins. Okay, so complements, and these are the two important images from the bullous and the pemphigus. Then moving on to the another important question or topic, that is the alopecia areata. So this is also an autoimmune disease, and what happens in this is there will be the patchy hair loss. As you can see here that only a segment of the hair is lost in the patient, and this one is called as a patchy hair loss, and this is the clinical feature seen with the alopecia areata. Another most important thing is the exclamation mark. You can say it as a buzzword or the hint words which can be given in the question. So whenever you see this exclamation mark sign and alopecia, then the answer 100% the answer will be the alopecia areata. Then turning gray phenomenon is seen. That means the hair which are turned gray, these will not be oh, lost. Okay, so these hairs will be preserved, as you can see here that the gray hairs, so these hairs are not lost. Okay, so this is called as the turning gray phenomenon. And another important feature seen with this alopecia areata is the nail changes. So the nail, you can see pitting, regular and the superficial. So this is the image which you can see in the alopecia areata, the nail changes. So you can appreciate here that they are pitting present, and they are superficial and they are regular. Okay, so important things which you must remember from this alopecia areata: exclamation, then patchy hair loss, and this nail changes. Okay, then moving on to another very important topic, that is the psoriasis, and another important topic will be the lichen planus. Okay, so you can expect one question from this, either from the psoriasis or the lichen planus, and it is very important topic and easier also. There are some hint words which you need to find out, and by looking at those you can easily come to know for the diseases. Okay, and one important thing which you must remember from the derma is most of the diseases are either the autoimmune or the infectious disease. ठीक है, तो जो infectious diseases होंगे, these are coming in the integration with the microbiome. So do watch the microbiome videos also which I have posted, and in that I have covered the chromoblastomycosis, then the sporothrix, then the dermatophytes infection caused by all these things. So do watch that video. And in the autoimmune diseases like the pityriasis, like psoriasis, then this alopecia areata, then bullous pemphigoid, and the um, pemphigus. So all these autoimmune diseases have been discussed in this video. Okay, so whenever you get a question from the derma, just apply this basic concept that whether it will be the autoimmune and the infectious. So these are the most commonly associated diseases with the derma. Okay, so for the psoriasis, the hint word or the buzzword which you must look in the question is the silvery white scaling. As you can appreciate here in this image, you can see here that the silvery white like scaling is seen, and this is the classical feature seen with the psoriasis. So other features which you can see is the erythematous plague, then auspit sign. So this is also a pathognomic feature of this psoriasis. This is called as the auspit sign. As you can see here that the pinpoint bleeding is seen, and this is the auspit sign. So image based question have been asked on this auspit sign. So they'll give this image and they'll describe some clinical history, and they'll ask what is the diagnosis. Okay, so it will be the psoriasis. Then you can also see Monroe's abscess and Kuchok pustule. So these are also pathognomic features of this psoriasis, and whenever you find these things in the question, then go with the psoriasis. Their extensions are most commonly involved in case of this psoriasis, and there are also nail changes seen with this. So irregular pitting can be seen, as you can see here that the pitting is irregular, and regular pitting is seen with the alopecia areata. We had discussed it just 2-3 minutes before, and that is also an important finding which you must remember. Then this oil drop sign, so this is a pathognomic sign seen only with this psoriasis, and this image based question has been asked. So to remember this image, and Whenever this question is asked, so this image is asked, then the answer will be the psoriasis. And also subungual hyperkeratosis can be seen. So this is the image of the subungual hyperkeratosis, in which under the nail you can see the hyperkeratosis, and this one is also the classical feature seen with this psoriasis. Okay, so whenever these things are described in the question, or these images, or any one or two of the things are described like one liners or clinical cases, then do think in terms of the psoriasis, because that will be the most likely answer if these findings are seen. Then also there are various types of the psoriasis which are important, and the first one is the vulgar psoriasis. So we had discussed that vulgar means the most common variety. Okay, so this one is the most common type of psoriasis seen. Then psoriatic erythroderma. So what happens in this is the back or the trunk will be most commonly involved. That means more than 40% area of the skin will be involved. मतलब कि जो large surfaces वाले areas है उनमें ये psoriatic erythroderma की manifestation दिखेगी. And this is also called as the exfoliated dermatitis. Okay, so these are the important things, and these were the PYQs asked. Okay, then gutted psoriasis. So this was also a PYQ, and gutted psoriasis seen most commonly in the children, mainly after the upper respiratory tract infection. Upper respiratory tract infection, and this also can be called as post streptococcal pharyngitis. Like, see, if a clinical case is described, then they'll be definitely describing this thing, that they'll give the image of the gutted psoriasis, and the important feature which you need to look in the image is the dew drop like appearance. मतलब drop जैसे features दिखेंगे, किसी भी rashes दिखेंगी, drop like rashes दिखेंगी किसी भी part में, children की history रहेगी, and this post streptococcal pharyngitis. So they'll be describing a case that a child comes to you with the complaints of rashes. They can give the image of the rash, and they will say that history of streptococcal infection or sore throat 5-6 days back or 10 days back, ऐसे करके they'll be describing a case, and they'll ask you the diagnosis. Okay, so it will be the gutted psoriasis. Then in worse psoriasis, usually the skin folds are involved like the axilla. Then in the pustular psoriasis, pus-filled cells or pus-filled pockets can be seen, and this occurs due to the sudden withdrawal of the systemic steroids. And for the treatment of the pustular psoriasis, we will be using acitresin. Okay, and if this pustular psoriasis happens in case of pregnancy, then it is called as impetigo herpetiformis. This is also a PYQ, so questions have been asked on this impetigo herpetiformis also. Okay, so these were some important types of the psoriasis. Another very important feature or the type is psoriatic arthritis. So this is also a PYQ, and questions have been asked on the psoriatic arthritis. The image based questions have been asked giving the x-ray of the hands, and also clinical cases have been asked. So in this you can see two manifestations. Psoriasis means involvement of the skin, and we had already discussed it, that the silvery white plaques, then they'll be describing the nail changes and all. And along with that, if they say the involvement of the joints or the arthritis, then it will be the psoriatic arthritis. ठीक है, so question को break करना whenever you get these things in the question, right, clinical cases, so try to break the things and try to connect it with the MCQs, and then you'll be easily able to reach the diagnosis. मतलब कोई बड़ी बात है नहीं है, ठीक है. तो एग्जाम में भी इफ़ यू फाइंड एनी क्वेश्चन विच सीम्स टू अनफेमिलियर, मतलब अगर आप उसको फर्स्ट टाइम देख रहे हैं तो क्वेश्चन को 2 बार पढ़ना, रीड द क्वेश्चन 2 times, and then try to connect it with the options, break the options, and however try to reach the diagnosis. Okay, बस तुक्का लगाना नहीं है, मतलब तुक्का लगाना भी है तो किसी लॉजिक से लगाना, ठीक है. तो कुछ तो कनेक्ट करना क्वेश्चन के साथ में, एंड द हिंट कैन बी गिवन इन द क्वेश्चन, मतलब हिंट तो क्वेश्चन में रहेगा ही रहेगा, विच विल हेल्प यू टू रीच द डायग्नोसिस इजीली. सो आराम से अपना टाइम लेना, फिर सोचना, फिर पढ़ना, फिर आंसर करना क्वेश्चन को. ओके, एंड दिस इज द PYQ, दैट ड्रग ऑफ चॉइस फॉर द psoriatic arthritis, it is the methotrexate. Okay, so this was all about the psoriasis which you must remember. Then moving on to the pityriasis vesicolor. Okay, so this is also a repeat topic, asked multiple time and asked in the integration with the micro. Okay, so see, this is the fungal infection, and this is caused by the Malacia furfur. Okay, so this is the causative organism, very important. In clinical feature is the hypopigmented perifollicular macules, and you can see fine rice powder like scaling on the skin. See here, in the psoriasis, we were seeing white, silvery white scaling, and in case of vesicular, we were seeing fine rice powder like scaling. Okay. So these all are the hint words which can be given in the question, and you need to find out these words. मतलब बस ये फाइन पाउडर या फिर सिल्वरी वाइट स्केलिंग देख के ही आप आराम से पहचान सकते हो कि वो क्वेश्चन में आंसर क्या हो सकता है उसका करके. ओके. Then investigation KOH mount. See, it is a fungal infection, and for most of the fungal infections we will be using the KOH mount. ठीक है, तो basic logic है ये. माइक्रो में भी यूज होता है यही वाला कि whenever will be doing the investigation for the fungal infection KOH mount. ठीक है, फिर on that you can see a spaghetti and meatball appearance. So this is the image, and you can see here that these are the meatballs, and this looks like the spaghetti. So spaghetti in a meatball appearance. So this is also a very famous question asked in the FMG, and it is almost a repeat topic. Okay, so image भी याद कर लेना. Remember the image and also the spaghetti and meatball appearance. Then on the wood lamp, you can see yellow or apple green color fluorescence, and treatment is the topical ketoconazole and systemic fluconazole. Okay, and also this is the image which can be seen hypopigmented perifollicular macules. Okay, so you can see here that these are the hypopigmented areas which are seen with this pityriasis vesicolor. Okay, then moving on to another variety of this pityriasis. So it is the rosea, and rosea means red color spots are seen, as you can see here in the image. So red color small spots can be seen, and this feature of the rashes, this is mainly called as the herald or the mother patch, asked as an image based question, and this appearance is called as a fir tree pattern on trunk. Okay, then in this pityriasis rosea, you can see colorate of scales seen. So this is the colorate of the scales. You can see here that a circle colorate like thing of the scales is seen, and classically seen with this pityriasis rosea. Okay, तो easy है. रोजिया से रेड कलर याद कर लेना कि रेड कलर के ऐसे lesions दिखेंगे, and appearance called as a fir tree pattern on the trunk, and the causative organism is the HHV6 and 7. Okay, then the pityriasis alba. So alba mein we know that it will be hypopigmentation, and something like white patches can be seen, and whenever you see this alba, no, think कि वो white patches की बात हो रही है. And hypopigmentation on the face most commonly seen with the children, and this is a type of the atopic eczema. This was asked as a PYQ, and this is the image of this pityriasis alba. So image based question have been also asked on this, so you can appreciate here that hypopigmentation is seen on the face, and this is seen with this pityriasis alba. Then the lichen planus. So this is also an autoimmune condition, and autoimmune मतलब जाहिर सी बात है antibodies बनेंगे, and antibodies will be destroying the skin. Okay, so what all manifestations can be seen? The classical thing which can be seen and remembered is the 5 P's. So plain होगा ये, then the papules or the क्या बोलते हैं plaques, these are the purple color. जो भी lesions होंगी they are in the purple color. Polygonal है, pruritic है, papules and macules can be seen. So this is the image, and important image based question is asked, and you can see here that these lesions purple color की appearance है इनकी, and these are the pruritic lesions and polygonal in shape. Okay, then three important features seen with these are the lacy or the reticular pattern on the mucosa. So this is the repeat image based question, as you can see here, lacy appearance. So this is the lacy like reticular appearance pattern seen on the mucosa, and whenever you see this image or something described like this, then blindly mark the answer as the lichen planus. Okay, then in the nail terium, so this is also pathognomic feature, this is also pathognomic feature of this lichen planus. So whenever you see this terium, then also mark the answer as the lichen planus. Then scalp, on scalp you can see scarring alopecia, and this is associated with the HCV. Then another two important features seen are the hyperkeratosis and the irregular Okay, so these are the important things which you must remember from the lichen planus, and you can expect a question from the lichen planus or the psoriasis. So it is a must know topic. Then to another important infectious diseases are the Condyloma acuminata and the Condyloma lata. So Condyloma acuminata, it is caused by the HPV mainly 16 and 11, and this one is the secondary syphilis, manifestation of the secondary syphilis. So how do you differentiate between the acuminata and the lata? See, in acuminata there will be the cauliflower like growth, and these will be pearly fungating cauliflower plague like. Okay, so matlab whenever you see this cauliflower like growth, then answer will be the Condyloma acuminata. But when you see this elevated papules which are white in color, then the answer will be the Condyloma lata, okay, associated with the secondary syphilis. So this is on the pearly papule, this is the white papules, whitish papules. Then this will be the Condyloma lata. Okay, so the differentiating factor. Then moving on to another very important and a repeat topic, that is the sexually transmitted diseases. Okay, so three important: syphilis, chancroid, and the lymphogranuloma venereum. So questions are asked on the causative organism and the treatment, and also what kind of ulcer it can cause. Easy to remember. See, syphilis causative organism is the Treponema pallidum, and the ulcer which it causes is the painless. So both the genital as well as the lymph node, they are painless, and treatment is the benzathan penicillin G. And investigation, dark field microscopy, previous year question asked multiple time this one. And dark field microscopy mein there will be like a dark field will be present, and you can see the organism here, Treponema pallidum, and image based question can also be asked on this dark field microscopy. Then if at all a case is asked, then it will be adult male, or they can give a history of the truck driver, multiple sexual partners, and genital ulcers, and the feature is the painless. So painless genital ulcers are seen. What will be the diagnosis? So it will be the syphilis, and if they ask the investigation of choice, it will be the dark field microscopy. And both these are the PYQs, मतलब clinical case भी पूछा गया है इस पे, और investigation of choice पे भी question पूछा गया है. Okay. Then about the chancroid, so the causative organism is the Haemophilus ducreyi, and this is also a PYQ. Then जो ulcers है इसकी, both will be painful. Okay, easy to remember. Syphilis में painless दोनों ही painless, बस याद रख लेना दोनों ही painless होंगी. And in case of chancroid it will be painful, so both will be painful, genital and so both will be the painful, and the treatment is the azithromycin. We will be giving only one dose, single dose of azithromycin. And an important feature seen with this is the school of fish or the tram track appearance, and this can be described in the question if at all a clinical case is asked. Then lymphogranuloma venereum, so the causative organism is the Chlamydia trachomatis. So इसमें थोड़ी सी चेंजेस है, मतलब सिफिलिस में बोथ वर पेनलेस, शंक्रोइड में बोथ वर पेनफुल, बट इन केस ऑफ लिम्फोग्रैन्युलोमा वेनेरियम वन इज़ पेनलेस, वन इज़ पेनफुल. तो जो जेनाइटल वाले हैं दैट इज़ पेनलेस, बट जो इंग्वाइनल वाले हैं मतलब lymph node है उनकी swelling हो जाती है, so it will be the painful, and this is also called as the inguinal bubo. Okay, and this is the feature seen with this LGB, and you need to remember this. बस ये थोड़ा सा कंफ्यूजिंग है, बाकी दोनों तो ईजी है, मतलब सिफिलिस में पेनलेस, सैंक्रोइड में पेनफुल, एंड लिम्फोग्रैनुलोमा वेनेरियम में पेनलेस एंड पेनफुल. देन doxycycline is a drug of choice, and if the patient is allergic to this, we can give the azithromycin. Okay, so any of the one can be used, but doxycycline is the drug of choice. Okay, so these were the things from this syphilis, chancroid, and the LGV. Then moving on to another important feature, that is the Koebner's isomorphic phenomenon. So this is the image-based question which was asked. So they had given this image and they had asked which phenomenon it is. It was the Koebner's phenomenon, but also question can be asked like this phenomenon is seen with all of the following diseases except. So you need to remember the list of the diseases. So it is seen in the psoriasis, lichen planus, vitiligo, Kaposi's sarcoma, and the Pityriasis ruba. And this is also quite important feature. See, if a clinical case is described, and in the case they will describe the clinical features, like if the psoriasis, then they'll describe the scales, then nail changes, then along with that they can describe the coibnous isomorphic phenomenon is seen or it is positive, and they'll describe some options. And this also can help you, right? Clinical cases में if you find this word that coibnous isophenomenon is positive, तो ऑप्शंस में रूल आउट करना और पता लगा सकते हो आप कि कौन सा वाला आंसर होगा उसका. Then another important infectious disease is this molluscum contagiosum, and the causative organism is the pox virus. Okay, so important है ये भी asked as a one liner and the image based question. Then this is also an important and a repeat topic. So in Pitigo, the most common causative organism is the Staph aureus, most commonly seen also in the children, and most commonly involved is the face. And this is how it looks, honey colored crust. And if image nahi deke, if they say honey colored crust in the question, then also the answer will be the impetigo. And if at all they give the image, so it will be very easier to find out that it is the impetigo. Okay, then color on wood lamp light. So you need to mug up this whole चार्ट मतलब द टेबल जो भी है ये पूरा आपको बाय हार्ट करना पड़ेगा, बिकॉज दिस इज अ रिपीट टॉपिक. मतलब फ्रीक्वेंटली क्वेश्चंस हैव बीन आस्क्ड ऑन दिस कॉर्निबैक्टीरियम एंड द एरिथीमा, विच कलर इट विल बी गिविंग. सो इट विल बी गिविंग द कोरल रेड कलर cornybacterium. The other things like the vitiligo, it will be giving the chalky white, then tinea vesicolor golden, Pityriasis vesicolor yellow, and squamous cell carcinoma red, and Burow's scabies green. So this is also a PYQ asked. Okay. So these were the important things which you must know from this dermatology, and you can expect around 2 to 3 questions from this uh, PDF that from the dermatology you can expect it. Okay. So along with that these videos, so do watch the videos of the images and the one liner. It will be helpful for you, and also it will help you in boosting your preparation, and quickly you can cover all the things from the dermatology which are important. The link of these videos will be given in the description box, so do check the description box, and also join with me on the Telegram channel for more amazing stuff related to the FMG, and also for the PDF join the Telegram channel. So once again, thank you so much guys for watching this video. Comment below how did you find this video, is it useful to you, and share the video with your friends. And if you're new to GrowMed, subscribe to GrowMed. Once again, thank you so much guys. I am Dr. Padmini, your mentor for the FMG. All the best for the FMG. May you all excel this exam. Once again, thank you. Bye bye.